Good morning. This is Kevin Kirkpatrick, CEO of Avery Professional Group. I have a exciting topic today, talking about relocation and stuff. And with that in mind, our guest is Patrick Dunn, the founder of Benefi. So, Patrick, good morning. How are you?
Very fine, thanks, Kevin. Great to be here, and super excited to chat with you about this fascinating topic.
Yeah, that's awesome. So, what I thought we'd do is if you could just give us um, the quick demo or discussion of kind of what you what you guys do, and then we'll go from there.
Yeah, so Benefi is a platform that helps companies attract, retain, and engage talent by helping issue and manage a better kind of signing and retention bonus. It's super helpful for the healthcare industry because, according to Jobs Board Indeed, there is not a job that exists that has a higher incidence of signing bonuses than nurses, but physicians are quite high on the list, as are medical technicians and personal support workers. And for recruiters or HR leads who are looking to find these folks and keep them around, and also keep them around in a fiscally responsible way, Benefi is a great platform that helps companies manage this process in an effective way. So that's the kind of the super fast elevator pitch. We help industries or organizations de-risk the investment in great employees. And if you think about what Carta does for things like stock options, we're doing for signing and retention bonuses.
Awesome. I just flipped through a bunch of the slides you sent me, so I apologize. It looks like there's a lot more slides than I was prepared for. So
no, timing was perfect. Nobody wants to hear me go through a million slides a day, so it was perfect. And this sort of topic, I think is really interesting and timely right now. What you're showing up on screen is a really neat article that just came out literally yesterday, talking about a doctor who was hired to work in a remote area. Apparently, she took a $100K signing bonus, and didn't honor kind of the terms of her contract, and is now working in BC right now. And unfortunately, the article highlights a problem which we think is pretty prevalent right now, where folks are taking a signing bonus, they're not honoring the terms of the contract, they're moving on and kind of taking the money with them. And there's a couple challenges for organizations, healthcare organizations. One of which is, sometimes this process isn't tracked well, where because folks are keeping track of this process on an Excel sheet plus their payroll. You already know what happens. Someone will quit or move on, and the organization will forget about it. It's not tracked. There's no link between that payroll and the contract. And administratively, these things are kind of tough to administer. And Benefi helps kind of alleviate this issue. And this issue that you're seeing in this article is less likely to happen with a Benefi in place, because we again help de-risk the process for the employer.
Yeah, awesome. And I've seen this in the past where we I'm going to stop sharing these screens here. I've seen this in the past where some organizations will give a signing bonus over a period of time, right? But you're right. Like every year, someone has to come back and say, "Oh, is so and so still practicing?" Because and stuff like that, right? So it's but it's off of someone's spreadsheet, right?
Yeah.
It's funny because this incentive piece is a major thing with a lot of communities when it comes to recruiting physicians, is that they believe that that's going to be their competitive edge, right? We'll give them this money. And I laugh because if I take 3 different communities right now that I've seen, like one is I worked for a year with Peterborough, and they had a small signing bonus of $15,000 over 3 years. And all the physicians that we recruited, none of them, they came for it. They asked about it afterwards, right? So it wasn't they didn't come to Peterborough or the Peterborough County. A couple came to Norwood and stuff like that. They didn't do it because they wanted the $15,000, right? And so, and it's funny, like Kingston's offering $100,000, right? And Kingston's got a medical school in with residents in Kingston, so it should be fertile ground for them. But and the problem I have is that I don't think offering incentives and signing bonuses is necessarily the reason that people come. And I've seen in some communities where they come, they do their 5 years, and they leave anyways. So you're never getting further ahead because it's constantly a temporary solution. Now, when we talk about physicians from the UK, there's a lot of barriers, right? Like they've got to pay for immigration, they've got to pay for actual relocation. So in those instances, I encourage my clients to pay for relocation or pay a large portion of the relocation and to pay for the immigration costs, because then you're removing a barrier. Someone's coming for the position, right? But they're not having to bear the costs of relocation, because if someone came to you and said, okay, Patrick, we'd like you to lead the benefits for all of these organizations in the United Kingdom, are you necessarily going to go if it's going to cost you $20,000 to relocate your stuff and $2,000 in immigration? Like, it would have to be drastically different. And the reality is, in a lot of cases, the actual compensation, whether it's fee for service or a salary, is often similar, right? Like there's very few provinces or communities that are offering drastically more than somebody else, right? So it becomes a very big focus on that component. But I think where companies like yours will provide a huge value is that, for ways when the relocation is included and is a cost, managing that cost, mitigating those risks and stuff are still going to be paramount. Whether you call it an incentive or signing bonus or whatever, there's still, those costs necessary, right?
Yeah, I really like that comment. I like your approach of advising your clients to pay for relocation. And I think it's also, if we're talking about hiring, and it's a great segue into the kind of the focus on the UK today. I think if you're offering, placement for a great doctor to the UK, what's really interesting is if you're coming from the UK or anywhere else of the United States, you're often what's seen as credit visible. And what this means is, you don't have the same credit scoring system in the UK as you do here in Canada and the US. And arriving in Canada, they actually don't know who you are. The banks don't know who you are. You have no credit history. And you might be, a wealthy doctor in your home country, but you might actually have trouble getting a car loan or putting it down or essentially buying a house here because simply you don't have the established credit history. And we've actually found things like signing bonuses as actually really helpful to get people established, simply because they don't have the kind of the financial institutions that we have here that we in some cases take for granted for having lived here for a while.
Yeah, and that's interesting because sometimes I've seen organizations include aspects of real estate costs in their relocation budget, right? So it's like, I'm not saying don't spend money, let's say. I'm just saying, spend it wisely, right? Like, if it's a scenario where you say, okay, well, we'll provide the down payment and real estate costs for you, then there's different aspects, right? And it's and it's just finding those solutions to do that. And I have seen some people rent for a year with the hospital providing a guarantee and stuff like that until they can build their credit and start generating income, right? Because again, if you're going to make $25,000, $30,000, $35,000 a month, it won't take long to improve your financial situation and prove yourself in Canada. And there's certain banks like Scotiabank, because of their partnership with MD Management and stuff like that, will go a long way towards working with these physicians. And some of them actually have, I think it's Scotiabank actually has a program for IMGs
Hmm.
including physicians. Yeah. So they're, and it's nice because some banks like Scotia, now they're my bank. So I'm going to throw out a bunch of stuff and send this video to them. Like I have a great guy that helps manage my business, and does a lot of the work with physicians in my area. So, it's definitely part of it is getting those right partners, to help transition that process, right?
I love it. Yeah, and I know this is a great topic, and why a lot of the audience is here. Let's talk about recruiting physicians from the UK in particular.
Yeah, so it's interesting, and depending on the individual province, the licensing is different, right? Let's keep this. I mean, most of my network's in Ontario right now, so we'll start with kind of Ontario. In Ontario, the CPSO has made it easier for UK family physicians to come to Canada, right, and get licensed. So the immigration process is not, it's cumbersome, but it's not difficult. The hospitals will do an LMIA and get a work permit. They can do it an open LMIA while they recruit physicians and stuff like that. So the process can be done earlier. If you have what's known as your MRCGP, which is the maximum licensing in the UK for family physicians, you can get a license in Ontario without the need for supervision and without the need to write exams. Now, if you're a specialist, you can get a restricted license if you're deemed eligible by the Royal College, but then you're required to write the Royal College exams and the LMCC exams. So it's a little bit harder for specialists. They've got exams and stuff like that they need to do as well. But the interesting thing is a lot of the physicians in the UK that have reached out to my firm or that we've reached out to are not originally from the UK, right? So they're already used to moving, predominantly moving from one country to another. And a lot are looking for the lifestyle and the diversity and such that exists in Canada. So we've seen a lot of that.
So Canada's an attractive destination for these folks. Is that right?
I think so. Like, you mean the compensation is better than the NHS, I think, for the most part. I think we fund things a little bit better than they do. Whether it's not like they're trying to come from Florida to Toronto, so the weather's not a major consideration. Lifestyle for children and those types of things are definitely key drivers. It's probably 80% lifestyle and environment, and then 20% compensation, right? But what we need to realize is that, the bulk, if you're eligible for a license in Canada, you have to be basically fully qualified in the UK. So if you're fully qualified in the UK, you're at the top. You're at the top of your profession, right? So what I think people need to understand is that you're going to have to lure them out of the UK. They're not just going to hop on a plane because Canada's calling, right? So as we create an experience and a recruitment process and a recruitment experience for them, which includes things like the financial considerations and stuff like that, and whether it's a forgivable loan or whatever it might be that helps them get across those barriers, I think that's the key. And our training programs are quite similar. So and there are some similarities in how medicine is practiced here. So I think it's key. And then nurses have been coming from the UK for years, right? Like I worked for St. Mike's in Toronto, and we recruited nurses from the UK because that it was just another viable talent pool, right? And it's a pool you have to market to. I think it's harder to headhunt. Like calling someone out of the blue and saying you want to come to Canada is less effective than marketing the lifestyle to them, right? And I actually have a website that I own that's in process called Canadian Physician Recruiter, and the goal for that site will be to put information about how to get licensed and how to go through immigration and stuff like that as a resource, and then we'll push that site out and see who engages with it, because they'll have self-identified, right?
Yeah. That's fascinating stuff, and I'm actually really curious about the UK versus the US. Is there a difference between one market versus the other?
So the UK has some private and some public. They're predominantly public in the UK. Sorry, the US has public and private, but public is predominantly Medicaid and Medicare. The challenge right now is the US has a different immigration process and a licensing expectation. So I have a physician that wants to come to Canada because it's closer to the US, and he can't get into the US because the US's philosophy is that you do your ECFMG from wherever you are. It's your international credentialing process. You get your ECFMG, and then you have to apply to a residency in the United States.
Hmm.
Right. So in Canada, if you do your exams, you don't have to go through residency. In the US, regardless, other than unique scenarios, you have to go through residency. Right. So that immigration path is a pain in the butt. So, because if you're 45 years old and you've been practicing for 10 years, 15 years, you're not going to want to go back to a residency, because it's really not really necessary. And secondly, it's financially prohibitive, right? Even going from Canada to the US requires exams. And it's funny because if you go to Ohio's website and you're a Canadian physician, you can get a state license, right?
Is that right?
Yeah, because they love Canadian training, and there's tons of Canadians in the United States. The challenge is you actually have to write your USMLEs, which is a series of, I think, 3 exams, in order to get immigration to get into the US, right? So you could have a license, but you can't work there, right? So, this is the challenge I have is that, physicians in Canada will look at a website and say, oh, I'm eligible for a license in Ohio or Florida or wherever, but then they don't necessarily realize that they have to have done those exams. Now, some of the younger physicians, newer physicians, as they write their LMCCs in Canada, they write their USMLEs as well. So they then have greater portability, right? So, because what's happened is even in Canada, if you have your USMLEs, you don't have to write the LMCC exams, right? So there's a reciprocity there. So what we try and do is we try and recruit from the United States to Canada as well, because it's easier for them to get a license, especially specialists. It's easier to recruit an anesthesiologist from the US than from the UK because the US guy, if they're board certified, doesn't have to write any exams, right? So
what I'm hearing, it sounds like Canada has structured our accreditation process to facilitate, newcomers from the US or the UK. Is that fair to say?
They're moving in the right. I think they're moving in the right direction, right? Okay. The challenge I have is that there's a lot of people. There's still this whole group of IMGs that trained in Pakistan or Iran or India that there's no path for them, right? So they're still either hoping to match to CARMs or writing exams and stuff like that. So we're biting off bits of the apple, right? It's like, okay, what's the easiest thing to do, easiest change to make that can have some semblance of an impact? It's like, okay, well, let's make it easier for the US because less risk because we know their training is comparable, or let's do it from the UK because people have been coming from the UK for years. We know their training, right? So now it's, how do we understand, the training in India if somebody from India wants to come? And I have kind of a personal view there is that, like, I just think that if we find a way to accredit their training and understand what's the medically safe route for them, then we should do that, right? But because it's funny because there are Canadians that go to India for surgeries, right? There is travel tourism in India. Yeah. So if I can leave Canada and go get seen by them in India, like, should we be looking at that, right? So I think there's those types of aspects of things that really need to be considered next, because as Canadians, we've seen it this year, and there's an article in the Star yesterday talking about levels of immigration. If we're going to continue to push our levels of immigration up, which I think we should, I think we need to put the time and effort into understanding and vetting credentials from other parts of the world where people come from, right? Because right now we've basically picked two allies and said, okay, here's the process for these two allies, right? And to be honest with you, it's easier for family physicians now because that's the political hot button, right? That's the button where everybody's like, I don't have a family doctor. But we haven't made it easier for the anesthesiologist or the surgeon and stuff like that, which we also have shortages of, right? So it's these, again, I'm not always a politically motivated guy, but we make these political decisions about parts of the system without looking at the overall system, right? So, I think that there's work that still needs to be done, but again, I'm very thankful for the progress that has been made in the last year. So I think we're heading in the right direction. And these things this big don't change overnight, right?
Yeah, I completely agree. And this time is flying by. I want to make sure we cover talking about recruiting a physician from let's say the UK. What does the process look like? And let's also talk about cost mitigation, because I have some thoughts in terms of how Benefi can help. But I'd love your thinking as well.
Yeah. So historically, once you identify the individual, you have to determine if they're eligible for licensure, and that will come down to where they've done their training and what training they've done. Then there is a website in Canada called Physicians Apply. So you encourage them to put their credentials to Physicians Apply, at which point they can identify whether or not they are eligible for a license or what needs to be done to be eligible for a license. So once we know they're eligible, then we can start looking at tangible steps. At that point, you then have to understand, where which hospital, let's say, for lack of, or community they're going to, and then address immigration, because those communities have to do certain recruitment steps in order to show the federal government that there isn't a Canadian available to do the work. So it's called a labor market impact analysis or something like that. I can't remember. It's LMIA. Okay. So you show the government that you've posted it on job banks, you've posted it on multiple other websites, and then you get a work permit, right? So the work permit plus the immigration gives you an entitlement the work permit plus the licensing gives you an entitlement to work. So then we've got to look at the logistics, right? Like, how do we get them here? And, how do we help them find an accountant, a lawyer, the bank and stuff like that. So working through all of those logistical things that, are time consuming and cumbersome, right? So one of our clients in PEI, they're working on an onboarding plan that takes all those things into consideration so that person gets onboarded well, right? So this is where I think like a Benefi comes in, is that if you can help with the logistics of that onboarding and that initial part, then it provides a service to the hospital from a risk mitigation and finance perspective, but it also ensures that the physician's going to get a better experience because somebody's managing that process, right?
Yeah, of course, I completely agree with you. We know hiring somebody from overseas or hiring any physician is a huge investment, and you want somebody who's going to stick around. You want to make sure that all that time and effort and investment isn't wasted. And as a holistic organization managing the mental, physical, and financial health of a new hire, I mean, there's a lot an organization can do to ensure that outcome. But our role in all of that is helping an organization confidently put a little more money in the hands of an individual. And if you're hiring a physician from the UK, sometimes a little upfront injection of cash can be helpful to kind of ease that transition. And our process is helping ensure it's a good experience for the physician, and also kind of de-risking that injection of cash, because we do track it in a better way, we do manage it a better way, and if that person is thinking about going somewhere else, we do provide a process to recapture those funds if they're moving somewhere else. So obviously we want to avoid, the scenario that's happened in the Manitoba article we shared yesterday or about yesterday, that, somebody's walking out the door with unearned money. We help kind of ensure that's not the case through our process.
Well, and it's hard, right? Because $100,000 to that physician, it's a lot of money, but it's worse for the community, I think, because that physician will go and earn $300,000, $400,000 in BC, but that community is really kind of that community is out a lot of money from probably a small tax base, so the financial impact is there. And in turn, what do they do if they successfully find another physician as well, right?
Yeah, that town's budget would definitely like that money back. It's probably politically unpalatable for the local government to have to deal with that issue. And mitigating that risk is something that I think a good organization should be doing. Absolutely.
Yeah, and I also think that's the worst case scenario, right? I still think that the ability to manage the process is just as important as managing the risk, right? Because the process can determine how somebody starts in your community and how they begin their adventure, as well, and also how that community finds that experience as well, right? So, I think that's the big scenario, and I think that the experience is key. And it's funny because I sit on a bit outside, right? Because I'm not part of any individual community. I sit outside, and I've come to the realization that what attracts physicians, is not necessarily any one thing as much as it's what they're going to and what the experience is like, right? Like, communities that do great onboarding get a great reputation, which then encourages other people to want to come there, right? The ability to create the clinical career as well as the family life for them is key, right? So I think communities need to stop worrying about incentives as much as they need to worry about creating a welcoming environment and then engaging physicians to understand that welcoming environment exists. Because most of the physicians I know and the ones I've placed this last year didn't go anywhere for money. They went because of the experience, right? And I had a lady that moved to Nunavut from Edmonton, right? And it wasn't the money for her. It was the opportunity, and it was the people that she met, right? And like I did a podcast with the chief of staff from Nunavut, and he was discussing kind of what they do and how they take care of and manage they manage flights for the physicians, they manage accommodations and stuff like that. So all of this experiential stuff that happens to them, it helps provide success, right? And I think that's where the more you can take something so that it's not spreadsheets on the side of somebody's desk, or, oh my gosh, I have to get this paper into the government. Like, the more you can manage things in a thoughtful manner, the better the chance that what's going to happen is that person's going to come and that person's going to stay, right? Because once physicians are settled in a community, right, and get past the 2 or 3 year mark, they don't move, right? That's why we have to recruit from the UK and the US, is because we're not training enough physicians necessarily, and then we're not utilizing them enough. So rural areas aren't getting physicians because there's too many opportunities in urban areas, or areas close to urban. And I think the more we build a community and build a onboarding and an experience around them, the more likely people are going to want to go to somewhere rural, because they're going for the experience that rural area can provide that you can't get in Markham, Pickering, or Ajax, right?
Yeah, I love what you're saying, and we know that holds true in other industries. Creating those first 90 days of the employee experience tend to be really important in terms of long-term retention. I know we're pressing up on time a little bit here. I know there's a bunch of folks in the line who may want to connect with you. What's the best way to, if someone is here from Kingston or Peterborough or anywhere else off the 401, what's the best way to contact you if they'd like to hire a UK-based physician?
Well, I think the easiest thing to do is find me on LinkedIn. That's where I'm probably most active, and do it and send a connection request. You can also call me. My number's on my website, which is averyprofessionalgroup.com. Like, so, there's a lot of, LinkedIn, and or you can even call me at 905-447-2151. Jay Krishna Bhatt sent us a message on LinkedIn, and I'll respond to Jay Krishna afterwards, because I'd like to understand a bit more about it before I answer the questions. So I will do that shortly. But it's been a pleasure chatting with you, Patrick, and I look forward to collaborating and introducing you to clients that need help and want guidance and want to give their physicians the best possible thing. So you mean, I'm assuming LinkedIn's a great place to find you as well, Patrick?
Yeah, LinkedIn, absolutely. If you're an organization that is looking to hire and wants to mitigate the risk of hiring the best talent on the marketplace, Benefi is a great way to do that. And LinkedIn is certainly a good place. Or you can send an email to pdunn@benefi.com, BENEFI. Would love to have a chat with anybody who is going through that process. And Kevin, great chat. Really love learning about this stuff. Yeah, and looking forward to keeping the conversation rolling.
Sounds good, boss. Have a great day.
Enjoy the day. Take care.